Chapter 2, Professions and Professionalization. In the previous chapter, Chapter 1, in your reading packet, we discussed the various moral theories that we'll be applying to professions and their roles in society. But before we actually do any application of our moral theories, we might want to know what exactly is a profession. Although many of us may have an intuitive notion of what a profession is, or sort of a normative notion, what we normally associate with the word professional, Chapter 2 actually gives us a far more technical notion of what a profession is. So professions and professionalization, we're going to be asking in this chapter, what is a profession? So what are its defining characteristics? How can I look at a particular occupation and say that occupation is a profession? And we also want to look at what an emerging profession is. So emerging professions, just briefly, are things that sort of toe the line between both a profession and non-profession. They're things that are becoming professions that may or may not be considered full professions yet. Necessary features of a profession. Michael D. Bales. One definition of profession is provided in your text. Comes from that of Michael Bales. Bales believes that there are three necessary features for an occupation to be considered a profession. The first of these is that whatever occupation we want to ascribe the term profession to must have extensive training. So it can't be something that everyone can do. It must be something that requires time to develop, a skill that needs to be developed or information that needs to be obtained. Secondly, whatever that training is, a part of it, a significant part of it, must be intellectual. So while it may take a long time to become, say, an electrician or a plumber, that there is extensive training, the training tends not to be of the intellectual sort that Bales thinks is required of a profession. The third necessary feature is that it provides some important service to society. So the word profession has to be ascribed to something that we find necessary in a society. So for example, lawyers, although often derided by a society, are actually necessary for securing our rights. Very few of us would want to go into a court of law without the expertise of a lawyer to help them out, mainly because we don't have that sort of knowledge. We haven't spent the time training, getting good at speaking in front of a court or learning courtroom procedure, which would be extensive training, though not necessarily intellectual. We haven't gone to law school to learn about the laws, to learn about how to interpret the laws. And this sort of training that the lawyer has does provide me with an important service. It protects my rights. So to contrast that with, say, the professional football player. While it's true that a professional football player may have extensive training, odds are that training doesn't require an extensive intellectual component. Aside from learning plays and so forth, a football player doesn't have to have a college degree, which is normally what Bales thinks of as the significant intellectual component. And as much as we might like to think we couldn't live without our football, it's probably not the case that football provides an important service to society. If football were to be gone tomorrow, our society wouldn't be radically different than it is today. Additional features of a profession. In addition to the necessary features that Bales mentions, he also notes that professions have additional features attached to them. So one thing that professions often have is some sort of process of certification or licensing. For example, CPAs. You're a certified public accountant. To be a CPA requires that you get a license. Lawyers have to pass the bar exam. Doctors have medical exams, and nurses as well. So there's some sort of formal certification required in order to become a professional. Professional organizations often accompany professions. So there's professional organizations of architects, university professors, again, lawyers, doctors, nurses, and so forth. Also, there's a fair level of autonomy in his or her work. Normally, professionals have fairly light oversight. University professors, for instance, have a broad range of discretion on what they teach, which texts they use, how many exams there are, how many assignments there are, and so forth. All of that is left up to the individual instructor. Now we should emphasize here that when Bales says these are additional features, these are not the necessary features. Necessary features are the extensive training, the intellectual component, and the important service. These are just things that often accompany a profession. So, for instance, while a university professor may have extensive training, they've gone through, obviously, if they have a master's or PhD, it involves a significant intellectual training, and although you may disagree, it provides an important service to society, putting out an educated workforce. On the other hand, university professors don't require certification or licensing. They may or may not be part of a professional organization. So while professors at universities are normally considered professionals, they don't have these additional features, and Bales says that's fine. They don't necessarily have to have them. Distinctions among the different kinds of professions. While Bales believes all professions must have those necessary conditions, he does indicate that there are differences within the sort of set of professions. And he believes that the breakdown essentially comes down into two main categories. First, there are the scholarly professions, university instructor or a researcher. Scholarly professions normally do not have a fee for service, like a consulting profession, the other distinction that Bales makes. So scholarly professions, university professors, instructors, or researchers are on salary, and there's no interpersonal aspect to the job. In other words, when one takes a course at a university, the university instructor isn't teaching an individual. Normally they're teaching a class. They're not consulting with an individual. They're presenting information for a large, or normally a larger audience. Consulting professions are different, and they carry with them different moral challenges. Consulting professions are those like law, medicine, or architecture. There's the fee for service, and they're acting on behalf of the individual. That is, the individual comes to the professional to look out for their interests. Now, the three salient features of this, again, in the consulting professions, is that one, it provides an important service. I think we all agree that things like law and medicine and architecture do that. They also monopolize the service. And this itself presents challenges that we'll be getting to in a moment. And the professions actually lack significant public control. That is to say, the public has very little say in how the profession deals with society. Who is it that trains lawyers? Other lawyers. The Bar Association is made up of lawyers who admit other lawyers to the bar. Medical school. Who runs the medical schools? Well, normally it's other doctors that run the medical school, decide on the curriculum, decide what should be taught. And the same goes for most professions. Even the scholarly professions have some of this. So for instance, who gets a PhD is determined by a particular department, and that department of other PhDs says, here's what the course of study should be. But notice in all of this, there's very little. No one's elected to a position of determining what constitutes a PhD, or who becomes a doctor or a lawyer. So the public doesn't have much control, yet at the same time, these professions monopolize their service. They're the only ones that can provide this particular service. As much as I might like it, I can't take my PhD and hang out my shingle and start taking patients in as a doctor, that is, as a medical doctor. So there isn't much in the way of public control. There's a minimal amount, but not a substantial amount of public control in these things. Moral challenges of the consulting professions in liberal society. As mentioned in the previous slide, there were three salient features of the consulting professions in particular. One, that they provide an important or essential service, they monopolize that service, and they are subject to little public control. Now, it's interesting that the three salient features also present the challenges for professions in a liberal society. Now, by a liberal society, we want to be clear. We're not talking here about liberal versus conservative in the traditional sense. A liberal society is one which recognizes individual rights, which recognizes that individuals have to be treated in certain ways. So even our society, whether one's conservative or liberal in the political sense, Democrat or Republican, everyone, or nearly everyone in our society, is a liberal in that we believe people have rights that need to be respected, that government needs to be limited, and that a people ought to have a say in that government. Now, this can oftentimes conflict with the nature of professions. Professions provide an important, if not essential, service. Well, they're providing an important service to society, but at the same time, society has little control over how that service is provided. And this poses challenges. It puts an enormous amount of power in the hands of professionals. Professionals monopolize the service. They're the ones best able to judge who should be a professional, but again, this also means that the public has little control over it because most of us don't have expertise in all these areas where there are professionals. So the moral challenge comes from this privilege that society actually grants to professionals to do what it is they do in a society. One example of how a profession may be challenged in a liberal society deals with the monopoly of service. So, for instance, the medical profession monopolizes the distribution of health care in some way. Who gets health care is in part determined by whether or not a doctor is willing to see a patient and how much attention the professional is willing to give to a patient. Individuals without insurance often don't get the same standard of care as those who have very good insurance. So when a professional in a professional role that's providing an important service to society does not give the proper treatment, this is a concern for those in a liberal society. Again, what's the proper distribution of goods in a society? How should these things be distributed is normally determined by the public. But when we have systems where we have professionals who are doing and making those decisions, which healthcare products to give to a particular patient, which tests to do, and so forth, this can present certain moral challenges. This puts an enormous ethical burden on professionals. And so part of what we'll be studying here is how ought professionals to act, given this authority, this privilege that they have or have been granted by society. Emerging professions, Bernard Barber. Unlike Bales, Barber doesn't have a hard-line notion of what constitutes a profession. For Barber, there are varying degrees of professionalization. Some occupations coming closer to being that of a profession, while others are further away from being considered professions. He believes there are four essential attributes of a profession. Now, we want to be clear that the fact that he says essential attributes doesn't mean that he takes them to be necessary. So there may be some professions that have 3 out of the 4 of these. And Barber would be willing to say that that thing is a profession or is very close to a profession. The first thing he notes is a high degree of generalized and systematic knowledge. So for Barber, just like Bales, there needs to be this sort of intellectual component. Systematic knowledge is normally knowledge placed in an academic sort of setting. Professions are oriented to community interests. Again, here's that notion that a profession is something that provides an important service to society. So what that important service is, in this case, it's a community interest, what a particular community has an interest in. Some things, it may vary from community to community, society to society, what constitutes a professional. But Barber, again, here is essentially agreeing with Bales in that whatever we call a profession, it's something more than just simply an occupation. It has to have some other interest than the individual making money, say. Professions are part of organizations with established codes of ethical conduct. So what Barber notes is that when something becomes a profession, oftentimes there are organizations, groups that come together of these professionals that establish codes of ethics. Nurses have codes of ethics, doctors have codes of ethics, engineers, lawyers, so forth, all have their own ethical code. Now again, this code isn't established by society. It's part of this organizational structure that often grows up around things that are professions. Professions have systems of rewards which are primarily symbolic. Unlike normal occupations, which are people usually have an occupation in order to make money, professions have other sorts of rewards rather than just monetary rewards. Of course, professionals do make money. They want to make money. They may be in a profession because it can be financially rewarding. But professions also tend to have rewards which are symbolic. So for instance, there may be book prizes or essay prizes. Now, truth, some of these prizes may have some monetary award connected with them, but that's not why professionals try to get these awards. These rewards are symbolic. They show recognition from others in the profession that the professional has attained or achieved a certain status. Sometimes these rewards are simply being published. Having an article published can be something that a professional in a number of different fields views as a symbolic reward. Role of the university. It should be emphasized at this point that Barber's entire article is intended to talk about how a profession or an occupation becomes a profession. So for Barber, the role of the university is going to play an important part in this transformation. So a university plays, for Barber, an essential role in moving from the occupation to profession. First, it's used to transfer the basic systematic knowledge that is the basis of professional performance. So essentially what it's saying is that how does one become a professional or gain the knowledge of a profession? Well, you look to other professionals. And these other professionals that transmit this knowledge are to be found normally in the university. The university also has two other sort of related functions. One, it's used to keep individuals up to date with the latest developments in the profession. So the reason there are professionals like lawyers in a university setting, lawyers that only teach, is because part of what they do is to track what's going on in the profession and then send that to or publish that so that other lawyers can keep up to date with the latest rulings and the latest interpretations of the courts, for instance. And of course, the university allows for full-time research to be done, which in part is that which keeps individuals up with the latest developments in a profession. Of course, this full-time research doesn't have to be just sort of the liberal arts sort of research that I've mentioned, like law, but medicine and engineering, the hard sciences will also have individuals that do this. But on top of those things, aside from simply passing on the knowledge, making new professionals, so the first point we'd make here would say that the university is a way of generating new professionals, keeping up to date with what's going on, and doing continual research in a particular area. The university also acts as the watchdog of a profession. So oftentimes you find in the university setting individuals that are critiquing what's done in the profession. They're looking at the way in which professionals go about doing the things they do. This could be in sociology or in business or in engineering. So business schools will often critique the methods that the professional business person, if in fact there is a professional business person, will critique the ways in which they go about doing business, how corporations operate. Economists in the university will talk about how other economists out in the world gather statistics or interpret information, economic information. So the university plays an essential role in all of this for Barber. The university is the place where we essentially generate professionals, watch over professions and professionals, and keep up to date with what's going on in a particular profession. Emerging or marginal professions. So what exactly is an emerging profession? Well, according to Barber, an emerging, or as he calls marginal profession, has some or all the elements of established professions, but to a lesser degree. So going back to the beginning of Barber's article, Barber says that the essential attributes of a profession are the general systematic knowledge, community interests, there are organizations that establish codes of conduct, and there are symbolic rewards. So any occupation, I should say, that has some or all of those elements to them, maybe to a lesser degree, maybe they don't all have professional organizations, or maybe there aren't systems of rewards that are symbolic, whichever feature they may have less of. If they have most or all of them, then Barber says this might be a good candidate for an emerging profession. Journalism is one of those areas that some consider an emerging profession. Are there professional journalists? Well, it seems that more and more we're seeing master's programs in journalism. There are researchers who look at journalism and how it's done and critique it from a university level. But journalism, to be a journalist, to be a reporter, for instance, doesn't require that you have a college degree. Many news organizations are requiring it, or it might be difficult to get hired, but it's not necessary at this point. So journalism might be one that has it. It has a system of rewards. I believe they're professional organizations. There are codes of conduct that have been put in place, some in law, some not. So journalism might be an emerging profession, or perhaps now it's actually gone over into a complete profession. Um, what other characteristics do we have of an emerging profession? Well, they're normally pushed forward by an elite minority that have all the aspects of a professional. So, for instance, imagine there were some English departments where there were individuals who began to study journalism formally. They began to put together proper codes of ethics for journalists, talk about reporting, and it's normally these elites that push forward the idea of professionalization. So there may be a number of journalists who are out there who never had any sort of formal training, and then slowly, as some of these journalists do get more and more formal training and begin to formalize what it is they do in the university setting, then that occupation slowly becomes or starts to look a lot like a profession. But it's usually an elite, and this elite is oftentimes met with resistance. Nurses are one of those examples. For a long time, nurses were not considered professionals. That seems to now be changing. But nurses at one point, as we'll talk about later in the course, were simply the handmaidens of the physician. They did what the doctor told them. They changed bedpans or changed linens, did what they were told, dispensed with medicines, and that was it. That, of course, is changing. Now there are nursing schools, there are advanced degrees in nursing, there are specializations, there are codes of ethics, there are nursing organizations. All of these things have come into being over the last 30, 40, 50 years, maybe even longer now. And so nursing seems to be one of those things that started out as an occupation and slowly become now a profession. Often inadequate codes of ethics are established in an attempt to legitimate an activity as a profession. Here again, nursing is a good example. If you look in the back of your textbook, you'll see how the codes of ethics for nurses have changed over the years. Going back 50, 60 years, 100 years, early nursing codes were very simple, which were essentially following orders, a sort of military model. Later, nurses began to say there's more to our job than simply following orders. We have interactions with patients and their specializations. And so codes of ethics for the proper conduct of this new profession were established. So if you look at the appendix in the back where a number of codes of ethics are, you can see the differences in nursing codes of ethics. Attempts are made to institutionalize the occupation in a university setting. Once there is this elite that's pushing forth the idea that their occupation should be considered a profession, they're doing the research, they're doing all those things that are essential to a profession, the small group. Normally it's the institutionalization in the university that finally pushes something into a full profession. And that's seen by the role of the university in already established professions. Something that's not a profession, if it wants to become one, is going to need to have that sort of university representation to sort of legitimate it in the eyes of society. Professional privilege. There's some interesting implications of Barber's analysis of the nature of professions. By sort of dissecting the idea of a profession and an emerging profession, how occupations become professions, Barber is also showing us that these things are constructs, that they're social constructs. We make these things. We grant to professionals certain privileges, and those privileges can be revoked if the professional does not actually, or the profession itself, does not actually benefit society. So what we note here is that professionals do not have a right to practice, but are granted a privilege to practice. So the idea of formally instantiating something in the university setting is done oftentimes in public universities. The recognition of organizations or codes of ethics also may be a public sort of thing. So when Barber notes how these things come into being, what the implication of this is that professionals aren't something that have a right to be who they are. Lawyers don't have a right to the things they have a right to. So for instance, lawyers are required by their code of ethics to keep a confidence. And in most cases, the courts have recognized that a lawyer cannot be compelled to give up information that's said in privileged conversations. But note that those privileges, those protections, are socially granted. And so we want to keep that in mind as we go along. When we think to ourselves, well, that's how all professionals behave, or that's how all doctors behave, or lawyers behave, or so forth, we might want to ask the question, but should they act that way? Should they be allowed to act that way? So the difference here is between a right and a privilege. A right is a sound claim that one be permitted to act without interference. So to say I have a right to free speech means I have a sound claim that you not interfere with my speech, or that the government not interfere with my speech. If I have a right to life, that means that you don't have a right to take my life. It's a sound claim. Privileges are different. Privileges are a permission to perform certain actions provided specific conditions are fulfilled. So, for instance, I think we've probably all heard our parents say, I'm going to take away your privilege of, say, using the car. Now, if we've done something stupid and our parents says to us, we're revoking your privilege, your phone privileges or your car privileges or something, we don't then pound the table and say, you're violating my right to the car or to the phone. No, normally because since it's not our car or our phone, that is, we're normally not paying for it if we're kids or teenagers, then I can't make a sound claim to a right. My parents aren't actually violating my rights to drive a car because it's not my car, it's not my property, and so forth and so on. So we want to keep this in mind as we're looking at professions and professional actions and activities. We grant professionals privileges. We allow monopolies to continue and so forth because we think that these are good things, that they often benefit society. But if it were the case that a particular practice, maybe not a profession as a whole, but certain practices within a profession are no longer benefiting society, and they may in fact be causing harm, then we may, morally speaking, want to step in and say, no, that's no longer morally acceptable. So Barber's analysis is twofold. One, he's showing you how these things actually do occur, how we move from occupation to profession. But I think more importantly, he's showing us that these things are constructed and that these constructs can change. So for instance, we grant lawyers the privilege of lying in a court of law. A lawyer will stand up, even knowing that their client is guilty, and say, how do you plead? And they say, I'm not guilty. Well, what is a lawyer actually doing? The lawyer, in some sense, is lying. And we grant that privilege because it's part of a greater system that's supposed to ensure justice and so forth and so on. We'll be getting into this a little later in the course. But note that we're allowing them to do something that the rest of us aren't allowed to do. The rest of us are not allowed to lie to a judge or to a jury. If we're on the witness stand, we're required to tell the truth. So these privileges have to be justified in some way, and we have to make sure that this benefit still obtains for society in allowing certain practices to go on.